So friends, we are going to discuss today the management of some acute illnesses. Now, this is one domain in homeopathy which requires tremendous amount of skill and knowledge on the part of homeopathic physician, because there is a marked difference when you treat an acute condition and when you treat a chronic condition. In acute conditions, patients usually come without appointment suddenly, and usually you will be not prepared with what you are going to see. While in a chronic condition, you know in advance what sort of patient you are going to see. In acute condition, the symptoms come so fast that unless and until you don't treat it immediately and give a relief, there are chances that you may lose a patient, and this may give a bad reputation either to you or to homeopathy. Also, many times in acute condition you have no chance to repertorize, no chance to open your book, no chance to take the case home and study. So the knowledge, the skill, the differential diagnosis between the remedy and the disease should be on your fingertips. Otherwise, every second is very important, and the disease may progress very fast if you delay in starting the treatment. And last but not the least is the result. The result which the patient experiences with the homeopathic treatment in an acute condition will be his most important memory of his lifetime, that he, his family members and his friends will never forget, even after years of the disease. So, with this beginning introductory comments, I would like to touch upon the subject of acute illnesses. Now, as you know that Hahnemann was the first physician who differentiated the disease accordingly nosologically, what we call as the acute illnesses and the chronic diseases. And he says that the acute illnesses are basically of two types. The one which comes in an epidemic and the one which occurs sporadically. Here we are talking more of a sporadic acute illnesses. Now, in a setup in Bombay where I practice in India, about 35 to 40% of patients on day-to-day basis are mostly acute. And over a period of last 22 years, we have gathered experience not only in treating cough and cold or viral infection, but many pathological conditions, surgical conditions, gynecological conditions, neurological conditions, conditions that definitely demand a very high skill, a very huge knowledge on behalf of the physician, where there is a question of what is known as a life and death. In fact, we train physician in the art of critical care medicine and homeopathy. So, no discussion is complete without a practical experience. And as I will show you some cases, I am sure you will be able to gain some insight into the treatment of acute illness. Our first case for today will be a case of a child who I am treating for a very long time for his behavioral problem and dyslexia. He has got severe dyslexia. Academically, he is very poor. He has also got a behavioral problem. His constitutional medicine is Medorino. And one fine day, he walks into my clinic with a pain in the right hypochondrium, and I tried to ask him some questions to find out any aggravating factors, but he is not very sure about what aggravates his pain and what gives him relief. But it was just merely a pain in the right hypochondrium. And then I asked him to take inspiration and put my stethoscope on the painful area. And he then says that when he makes an attempt to inspire deeply, there is a pain in that particular part. Definitely this was not a pain which he was trying to act or malign. It was a genuine pain. And hence I advise him to be under my observation for 24 hours. It is very important that when you don't understand the disease on the first day, you should keep the patient under observation, because that will save your skin later on. And so the next day, we again ask him to come. But this time, his pain has increased about 10-fold times. When I mentioned to you that we kept him under observation means no medicine was given, and we had asked his parents to inform us on SOS basis. Because he stays very close to our health center, homeopathic health center, we took the risk of observation in his own house. Otherwise, such patients we usually try to admit them in a hospital and then observe. Now, so we'll start the video now and let us see how he behaves.
Okay. What is happening to you? How does that go on? Since when?
Yesterday.
All of a sudden, since yesterday, the pain has started. He complains of pain in the right iliac fossa, which has started since yesterday, all of a sudden. What else is happening?
Now, the most important rule whenever you are treating a very acute case is the art of observation. And the moment the person starts talking with you in acute condition, if he is conscious, you should pay importance to certain things. The most important is how he describes his complaints. This is very, very important. His speech, which is very important, and the gesture. Now in the above case, you will see that the speech is definitely soft. He is trying to put the inner lips into the mouth while talking. There is definitely an exertion on his part to answer the question about his pain, and this is the observation so far.
What makes the pain worse? Okay. He says that the pain is worse when he is walking from the slightest jar. It is aggravated when he is lying on the left side, and it is better when he is lying on the back or onto the right side.
You saw how he is trying to So this is a very important observation. This you should not miss in the case.
What he does?
He put his lips,
Can you
mouth.
see? Yeah.
yeah, and the perspiration.
Can you see this or not? It's a very important part.
The pain in the right iliac fossa is aggravated by lying on the back, aggravated while he is turning on bed. It is better by lying on the left side. It is better by bending his knees and pulling it upwards towards the abdomen. On examination, the findings are of classical acute appendicitis, where there is marked rigidity of the abdomen, tenderness on pressure. The palms are absolutely cold, especially the fingertips, and lips appear pinkish. His pulse is 81 per minute, temperature is 99.1 degree Fahrenheit. His appetite is okay, thirst is normal, urine and stool is fine. How are you feeling today?
Yes, fine.
What about your pain?
It's very less.
Very less, meaning how much percent less as compared to the day when you had come to us?
Too less. At work. While walking, coming away, I have a pain. Yes.
Pain in the legs. But what about the pain in the stomach that you had? The pain is not there at all, or it is there a little?
Sometimes I have.
Okay. Any other complaint, any other symptoms? Any nausea, vomiting? How is your appetite? Are you taking enough quantity of food?
I can't even eat well. Or potato and egg,
Yes.
bread. We are taking that much.
Do you feel hungry? Do you ask for food? Any change in your thirst? You're taking adequate amount of water, or you don't feel thirsty at all?
I take
What about your stool and urine?
last 3 days I had.
You passed stools. What was the character of stools? Very hard, so much so that you had to strain a lot. What about the urine? Any problems in urination? Any burning? Okay, any pain while passing stools? Any bleeding? Mucus in stools? Something sticky? Nothing like that. How is your sleep?
Now you see over here is that a person comes with a pain, and the pain is restricted more to the right iliac fossa. Now this is very characteristic of appendicitis, that usually the pain is always associated with constipation. Usually you will get in a history in appendicitis that a person has not passed stool since previous 1 or 2 days, or the stools were not satisfactory, or they were very scanty stools. With then the pain starts. It's very important that in appendicitis you have to be very careful with a child more than an adult, because chances of complications are extremely high in a pediatric age group as compared to the adults, because in pediatric age group, in a child, the mesentery, the quantity of mesentery, that is the fat tissue within the abdomen, is very scanty, and hence what happens over here is that the spread of infection can take place very fast. You can have peritonitis, you can have rupture, you can have many complications. While in an adult, because of an abundant amount of mesentery available, the chances that the infection gets localized are very strong. Second most important thing is never give purgatives in a person who has got appendicitis. Or when you are suspecting appendicitis in any person, don't give any purgatives, because giving purgatives in appendicitis will ruin the person's problem. It will burst and you will invite a lot of complications for yourself. So you have to be very careful. These are some salient features which I would like to tell you. Now when you are suspecting appendicitis, the first thing is that you should give a complete bed rest and keep the person almost on a liquid diet. Never give a solid diet to a person whom you are suspecting appendicitis, and the best thing would be to put him on glucose and fruit juices. That's all. Sometimes appendix is accompanied by low grade fever, but never a very high grade fever. Now the type of pain in appendicitis is always intermittent. That means it comes, stays for some time and then goes away. So this is very important and a characteristic type of pain in appendicitis. It comes, it stays, it goes. It's an intermittent paroxysmal pain. This is what you call as colic. The short term or a common man or a layman's language is, it is known as a colic. It comes, stays and goes. Now here let us pay importance to the modality of the person. Now in acute condition, this is very important. More than the ameliorating factor, it is always the aggravating factor which are to be given importance in acute condition. The first and the most important aggravating factor in this man is jarring or motion of any sort. He just can't move, he just can't bear any jarring, any walking. Second most important thing is that he cannot turn on any side. If he turns on left, he is aggravated. If he turns on right, he is aggravated. Only comfortable position is if he lies on the back. So this is also a very important aspect. The pain is so severe that he is hardly able to move in any particular direction. There is no appetite. He has not passed the stool on that day. So these are his acute manifestation, but otherwise he is very conscious, he is very cooperative. There is a very minimum anxiety, otherwise there is not much anxiety or fear. So here the importance has to be given more on the physical symptom. The gesture what you saw basically of trying to put the lips within the mouth is a very misguiding symptom over here. Even though this symptom has nothing to do with his appendicitis, this symptom is a very old symptom of this boy because this even existed before appendicitis, which we confirm with the parents. So this is very important that don't jump to conclusion moment you see in an acute condition, this is like that and I have to take it. No. You have to first ask the parents whether this symptom was there even before the person developed illness. If the answer is yes, then it does not have much value. And you will see that even after the attack got over in 24 hours, the lip sucking or lip picking is still there. That means this has nothing to do basically with the appendicitis. Of course, if your remedy that you select covers it, it is well and good. But otherwise, this is not so important. I will show you some cases where this has been a very leading factor for us to prescribe a remedy. Like in our pediatric age group, whenever we see this type of an individual who tries to pick the lips like this, or sucks, or constantly play with the lips, this is highly indicative of a remedy, arum triphyllum. Arum is a very important remedy, arum triphyllum, or bryonia. Kent has described innumerable cases of fever in a child with senna, chamomilla and bryonia, where this type of lip picking or lip sucking was present. So Kent gives very importance to senna, chamomilla and bryonia. While the bony cushion repertory, you will see that stramonium and lachesis comes very high. In fact, there are cases in literature where Vitulkas is prescribed for a case of fever on this particular indication where he gave lachesis on picking of the lips. There are many remedies including tarantula, helleborus, calibrome, arsenic, arnica, phosphoric acid, and Farokh gives tarantula and thuja as an important remedy. So this rubric requires a proper study. Now back to the case. You have seen the person, practically when he came to the clinic, he was holding the hand on the abdomen, bending in forward like this and trying to walk. So the pain in abdomen is such that it makes the person bends forward. The pain in abdomen is such that he has to hold the abdomen, hold the painful part with his hand. He has to support the painful part with his hand. So these are the important symptoms of the patient. The reason why he wants to hold is because he can't bear any jar, cannot bear any jerk.
So, Bryonia?
Very good. I think so. This was the first indication that we saw, because immediately picking of the lips, jarring aggravates. Even previously, if you saw, he had a cough which was worse deep inspiration.
What I noticed is also that his left eye was hanging. I don't know whether I saw it right.
Hanging is what?
Yeah, his left eye. Yeah, his,
Left upper.
yeah, his upper
Eyelid?
Pain in the right iliac fossa.
you see, it's different. The left and the right eye.
What else is happening?
So,
What makes the pain worse?
you're only trying to look to the doctor and talk, maybe that's why. Because the doctor is
Yeah, that's
telling you
possible.
that,
That's
yeah.
the way he looks. Yeah. It's straight ahead of me.
See, basically he has a behavioral problem, you should understand that.
Yeah, yeah.
And that is why see, his behavior is not normal.
Yeah, of course.
Are absolutely cold.
Is he a retarded child?
Not retarded, Rene, but just see,
His pulse is 81 per minute.
you see the type of pant he is wearing. See, this is how the Mediterranean patients usually wear, the dragons and snakes and
Yeah,
these, very zazzy type, you know?
Kind of,
Yeah, they're very zazzy people.
Sorry, what did you say? Very
Zazzy,
zazzy.
yeah. J-A-Z-Z. Now let us see the important symptoms which are worth taking in this case.
Relax.
This is very important that his legs are always drawn up, you know.
Yeah.
I cannot fully see them. Can you read them?
Yeah. Difficult.
Abdomen pain, lying back.
Yeah.
Yeah. And abdomen pain, turning the body.
Abdomen pain.
Walking when compels. Abdomen pain walking while. Abdomen pain, inflammation, appendix. Abdomen inflammation, appendix acute.
Appendix.
General side line on painful aggravates.
What, lying on?
Painful side aggravates. Extremities, coldness, fingertips.
He took a lot of rubrics from abdominal pain. Eh?
Yeah.
Yeah.
See, now what is most important in this condition is that there is an inflammation in the appendix. If you don't control it in the right time, the pathology will advance. So this is more important for us to know. That with homeopathic medicine, are we in position to find out the right medicines for this man? Well, if we can do that, we have done our job. Now, it is a very misnomer amongst the homeopathic physician that the disease has to go in the reverse order how it came. What is known as the Herring's law.
Except with acute cases.
First of all, it is not a law, it's a misnomer. Herring's law is an observation. There is a difference between a law and observation. The reason is that there are so many patients who improve and they never follow the Herring's law or Herring's pattern. So if there is a law, then nobody should improve. Secondly, the observation regarding Herring's law was observed in chronic cases and never in an acute cases.
Yes.
So one should never try to break the head in trying to observe in acute cases such condition. Rather, as a homeopathic physician, your duty should be that how best I can try to reduce the agony and how fast I can reduce the agony. In an acute condition, it is very important to separate out those symptoms which do not belong to disease or which rarely belong to disease on one hand compared to those what belongs to disease. Now in this totally 13 rubrics that you have taken, I am sure there has to be some symptom which do not belong to disease. Now let's start from the very most important thing. His speech was soft. We all knew that. He was trying to play with the lips. We all knew that. There were some gestures in this particular person. We all know that. This has nothing to do with his illness. So there were some amount of grimaces.
Grimaces?
Yeah, grimaces. So this is very important that it is outside the disease. If you see the modalities of the pain, they are very, very common to the illness, because all appendicitis person does not want jerk, they do not want motion, they cannot walk, they cannot exert, they cannot lie on the painful side. During the pain, the legs always draw up. So here we had nothing more left, Another very important part is the causation. Why did this appendix come? We tried to ask many questions to the father and the patient's mother, but we could not draw any conclusion why this thing had to start. The only reason that we could get over here was the examination. That there was an examination approaching, and maybe, as I told you earlier, that this child has got very poor performance in the school, and maybe that is why this could have happened. This was the only reason that we could try and gather over here. So in this case, because the mental symptoms are not very strong, we did not take into totality. But not taking a symptom into totality doesn't mean that we are not going to use the symptom, but we may use it at a later time when we are going to differentiate two common remedies. So this is also very important. That in acute condition, it's not always necessary to take all the symptom into repertoration. We may keep some symptoms which are not so important at a later time to differentiate the remedy when there are more than one remedies coming up. Now in this situation, 3 remedies came up very strongly. One was bryonia, second was Colocin, and third was Rustox. So 3 remedies came up very closely over here. So we had to differentiate them. Now, amongst the 3 remedies that are in front of you, remember Rustox is one remedy you should always think of whenever there is a suppuration, when there is septicemia. In the beginning stage, it would have been bryonia. Colocin comes as a middle stage and Rustox comes at the last stage. So Rustox is usually reserved for those conditions where there is an element of septicemia, and bryonia should be reserved for those conditions when the disease has just started. I think so bryonia was the remedy which the child required on the first day when he came to our clinic. But because we decided to keep the person on observation, we could not give bryonia at that particular time. Also, if you see over here that this person basically allowed us to examine him very comfortably, and even though there was an element of jarring and cannot lie on the painful side, the intensity of these symptoms were not very strong. Now in bryonia, please remember that the intensity of jarring and worse motions are to its very great extreme, which was not there in this patient. And hence, this was one differentiation why we never thought of bryonia in this case. So the choice basically then ultimately boiled down to, should we give him Colocin or should we give him Rustox? Now another very important difference that we could gather in this patient was the type of pain. Now in Rustox, the pain that one tries to usually get is of a sharp, pricking pain. This is very important in Rustox. A very sharp and a pricking pain you will get. The Rustox has got a marked affinity for pain in the umbilicus. Please remember, the umbilical pains are very characteristic of Rustox.
So the umbilical pains improve?
No, the Rustox has got marked affinity for pain in and around umbilicus like veratrum alp or like sena. Then another very important aspect in Rustox is the griping pains, The pains are very, very griping in...
Gripping.
Yeah. Many symptoms of the Rustox comes after eating in the abdominal problem. The worst, eating after. Now many people feel that Rustox is always better by motion. So why we give Rustox? But please remember, in repertory, Rustox is even worse motion. So if you see abdominal pain, motion aggravates, or abdominal pain, griping motion on, you will also see Rustoxicodendron. Then let us see Rustox are basically very thirsty patient as compared to Colocin. But this person, as I told you, did not mention any thirst to us. Now, let us see some characteristic of Colocin, which normally we see. Now in Colocin, usually one gets a definite history of mortification, anger and excitement as a premonitory or precursory symptoms before the pathology starts. And in this particular case, this was absolutely lacking, as I mentioned to you. Now here comes a very important aspect of anticipation. That Rustox is a remedy which is mentioned in anticipation, but Colocin is a remedy which is not mentioned in anticipation. And as I mentioned to you, this child was having an examination in just few days. And maybe that is why he was worried that he could not do well in the examination. Many symptoms in Colocin, some unique thing I would like to say, has to do with coffee. Drinking coffee in Colocin always gives a good relief to the person. And consuming coffee also produces a lot of problem. In Colocin, the pain is always very severe intensity wise compared to bryonia and Rustox. So the pain intensity is always worse in Colocin, 3 marks intensity wise. The way I told you, motion and jarring are always intensity wise worse in bryonia. So you will see that Rustox comes always in between this. So in Rustox, neither the pain are so severe, neither the jarring is so worse, neither the motion is so worse. So Rustox comes in between the intensity of the common symptoms of appendicitis, especially in a later stage and not on the first day. With this understanding, we gave him Rustox 10 mg, 1 dose, to be repeated every 2 hours. Then we kept the person on a liquid diet. We prescribed the medicine at around 6:30 in the evening, and around 9:30 I myself went to the patient's house to examine his blood pressure, his pulse. Now pulse is very important to examine because a high pulse rate indicates that there is a septicemia. So you have to see the pulse rate and you have to monitor the pulse rate, which is very important. It is a rough estimate, Patient on that night was only given fresh lime juice and nothing else was given, even though he was feeling hungry. And next day early morning we had taken a sample of blood to be examined to find out whether there is any element of leukocytosis or not. Next day morning again I examined the child. On physical examination, one should try to touch the part of the right iliac fossa, and see whether there is a presence of any tenderness or rigidity into this. Passage of stool in a case of appendicitis with relief of pain definitely indicates that a person is feeling well. Reduction of pain is a very important indication. When you palpate very deeply and there is absence of any tenderness is a very important symptom in appendicitis. And definitely improvement in the blood count, improvement in the fever, all this goes in favor of what is known as the improvement part. Now what happens over here in this case was that this particular attack got over very nice. And then the parents asked me a very $1 million question. That next month you are going abroad and suppose if this attack occurs, then what should we do? Now this is very important that I said, look, till I am there, in my presence I can assure you that I can always help your son. But in my absence, I am not very sure. You can trust any doctor and go and take homeopathy. I have no objection for it. So the patient said that no, we don't want to go to any other doctor. And then I said that in that case, if the child has any problem, you rush him to hospital and get his appendix operated. Because this is very important that once a person gets an attack, the second attack can come anytime unless and until you have not treated him quite long enough. Now in this case, if he has not got himself operated, then definitely we are going to repeat his constitutional medicine, that is the medurinum, and maybe that should take care of his recurrent attack of appendix. I have used one remedy with a great success in my practice for recurrent attack of appendicitis, and that is psychotico.
Psychotico?
Yeah, psychotico is a bowel nozzle. It's a bowel nozzle.
Okay.
Another very important remedy that we have seen in our practice is lachesis. Now lachesis and rustox, as I had mentioned to you earlier also, they always come into play whenever there is an element of what is known as a septicemia. So in acute appendicitis, you can write down the remedies which come to your mind is bryonia, rustox, lachesis, colocint, and one very nice remedy which I think so you all should know about, because without studying this remedy you cannot complete your study, and this is iris 10x. This iris 10x is supposed to be a specific in homeopathy for appendicitis.
What are the indications for iris
Yes.
10x and psychotico?
Yeah, I will tell you. For psychotico, there are no indications at all, I would say, because it's difficult. For iris, definitely I will like to tell you. Now, as you know, in iris 10x is not a very well-proved remedy. So you have to basically go to the general symptoms of iris if you want to prescribe iris 10x. To me, in iris 10x, the most important symptom which it shares with bryonia is homesickness. And the second important symptom which I look for in iris 10x is aggravation in the evening. Many symptoms of iris 10x are worse in the evening, that is at 3 o'clock in the afternoon, 3 p.m. and 11 p.m.
And
11 p.m. And typically the person shows the abdomen, the lower right iliac fossa is the most tender part, and there is only other mental symptom which I know of, which it shares with aconite, is a delusion he is going to die. So if you find with an acute condition a person feels that he is a delusion, he is about to die, it shares with aconite, and that is iris 10x. And the homesickness. So these are the things which you should know for an appendix.
Thank you.
Thank you.
thank you.